Let's look at how to hold the needle during an IV start. Notice how your needle is almost parallel with that vein. The wrist right here where the knuckles bend down, it's a perfect opportunity to slide that needle right inside the center of that vein. You don't have to worry about your needle being too deep of an angle to go through the bottom because you're really coming right through the center of that vein. You'll want to hold your needle on the sides rather than the top and the bottom. The reason is at this angle it's too steep and you'll penetrate the bottom of the vessel. By holding the needle on the sides, you can control the angle of needle insertion to almost parallel with the skin if needed. And that's where in the hand you will need those low angles. If you need to start an IV in the hand, this angle will be too deep, so that's why you want to hold on the sides. This technique also allows you to precisely drive your needle to the target vein. Also remember to keep the bevel of the needle up with a needle insertion. This is a mannequin arm, but I'm going to still show some of the different ways to hold skin traction. So this is a vein right here. It's a great target vein. It's straight and it's really engorged. So what you would do in this situation, you want to pull the up traction in this direction, and you're going to use the base of your hand and pull the skin taut this way. So you're kind of stretching out like a rubber band. Not so much that you compress the vein, but just enough to make that skin tight so that vein doesn't move. So you would come in, and you come in at that low angle, maybe 15 degrees, and aim for right at the top of that vein. You know, insert your needle like that. You would get your flash, advance 2 to 3 millimeters, lower your angle almost parallel to that vein, and you'll thread that catheter off. Notice how we're holding the side of the needle and we're threading off with our index finger while keeping the needle straight. One of the things that sometimes happens is sometimes you want to pull that needle out rather than threading the catheter in. So just be aware, thread the catheter off rather than pulling the needle out at the same time, just to be sure that you're in that vein. Holding the needle this way is also helpful when threading the catheter. Let's look at a couple ways to thread the catheter off the needle. If you're using your non-dominant hand for traction, then you will want to use your dominant index finger to thread. Sometimes you're going to need both hands to provide skin traction to appropriately stabilize the vein. In this case, you will maintain traction with both hands and use your non-dominant thumb and index finger to thread the catheter. Using the base of your hand to hold skin traction allows your fingers to be free to assist with needle insertion and threading the catheter. I'm going to give an example with the mannequin arm too of how you're stabilizing your hand on the patient's arm to give you precise control of your needle. If by chance you miss the target a little bit, I'm going to show you how to adjust to regain alignment to that vein. So we're going to again pull traction up while pulling skin traction down this way, and we're going to go in and we're going to go just a little bit left. And so I don't have a flash, so to precisely drive your needle, you're going to pull that needle back, you're going to realign to the center of that vein and enter into the center of the vein. And that's how resting your hand on that patient's arm is giving you very good control of that needle tip to go exactly where you need it to go. You can pull back and just get it right in the center of that vein. If you don't have your hand braced on the arm and you're holding up this way, you're in less control of that needle, and it's hard really to judge the correct angle, and it's hard to keep your needle even still to the target. So when you put your base of your hand down here, you really have nice steady control, and you enter that vein there, just like that, nice and smooth. Advance a little bit. Notice how precisely you can control the needle direction. If I went too far to the left, I can back the needle up and adjust my angle to the right and insert towards the target vein. This is very beneficial when you're dealing with small vessels and very difficult to find veins.